So, hello everyone for coming to this event today. And today's conversation will be about schizophrenia. It's an awareness session and information session. My name is Asma Begum. I'm the founder of Soul Sisters Empowering People. And this charity supports anyone, and that's anyone that's been affected by domestic abuse. We try to help with anything to regards to peer support, advocacy, just coaching, mentorship. And today we have Dr. Shakoor on. Thank you very much, Dr. Shakoor, for making the time. He's just come from work. And we are going to be running a number of sessions in the next few weeks and months on mental health. We do know mental health is a big topic, but those that have been affected by domestic abuse also do have effects of these mental health issues later and during the time they are going through the abuse. So things like schizophrenia, dissociation, PTSD also occurs in victims and survivors of domestic abuse. So this is why it's quite important to our charity that we raise this awareness and talk about it. So Dr. Shakoor, he's called Abdul Shakoor, he's a community link and he's got expertise in dementia, autism, and he's a mental health therapist. And without further ado, I am going to pass it on to Dr. Shakoor. And any questions you do have, sorry, Dr. Shakoor, please put it in the chat box. And please do share your emails if you haven't already. If you haven't registered with me already, please do put your emails in the chat box. And any questions you have, please put it in the chat box. I'll keep an eye out, and we can ask Dr. Shakoor at the end of his session. So we'll have 15 minutes at the end. Is that okay, Dr. Shakoor?
Yeah, that's fine. No problem.
Okay, pass on to you. Thank you.
Thank you, Asma Bita. Right, we are talking about schizophrenia today. The first thing is what it is. It's a word that makes many people very, very uneasy. And the media regularly use it inaccurately and unfairly to describe violence and disturbance. So there are a lot of myths around this as well, which we will talk today. English is not my first language, so if I can't pronounce certain words, you can always ask me in a question or anything, and I can again repeat that. Uh, when it comes to mental health or anything, obviously we have Googles and people go on Googles. So when we are searching, we have to be careful that we are going to authentic websites. And for any health sessions or anything, I always go on three main websites. There are so many, and there are so many fake websites as well, or misinformation. So NHS, National Mind, Rethink, and Healthy Mind. These are the websites which and Royal College of Psychiatry. These are authentic like websites, and we can get the right information. Now that particular condition, which is called schizophrenia, it is one of several disorders called psychosis. And this word is also used to describe violence and disturbance. That's why in media sometimes they have very kind of a negative pictures. So it's hardly surprising that many people with this diagnosis find it unhelpful. It can feel as though society has judged you to be violent and out of control when you clearly are not. We still use the word schizophrenia because a better one has not been agreed for the pattern of symptoms and behaviors which are related to this particular issue. Now, even if if you think that there are if you don't find the word helpful, we hope that the information which I will give you today will be useful. I have collected all these informations. I have gone through very many papers on NHS, Royal College of Psychiatry, for many years, almost 35 years now. Now many of the symptoms that are part of the schizophrenia will also occur in other disorders. They tend to be called psychotic symptoms. And schizophrenia is a disorder of the mind that affects how you think, how you feel and behave. Its symptoms are described as, they have two terms to describe these symptoms, and they use it, positive or negative. So when it comes to positive symptoms, I don't know why they call it positive symptoms, but that's how it's been. Uh, these are unusual experiences. Many people have them from time to time, and they need to be a problem. In schizophrenia, they tend to be much more intense, troublesome, and preoccupying and distressing. Now, one of the symptoms, which is called hallucinations, it happens when, if you hear, smell, feel, or see something, but it isn't caused by anything or anybody around you. The commonest one is hearing voices. Now, what do voices sound like? They sound utterly real. They usually seem to be coming from outside you, although other people can't hear them. You may hear them coming from different places, or they may seem to come from a particular place or thing. So if you are sitting in your room and you might feel that, oh, from near the door you can hear some voices. So voices can talk to you directly or talk to each other about you. It can be like overhearing conversation. So maybe a person with this feel that somebody is talking to him, or he can feel that there are two people talking about him or about something else. It can be like overhearing the conversation. They can be pleasant but are often rude, critical, abusive, or just a plain irritating. You may try to ignore them, talk back to them, or even shout back at them if they are particularly loud or irritating. You may feel that you have to do what they tell you. So sometimes you hear that they are saying something and they want you to do it, and you feel like that you should do it, whatever you are hearing. Now, where do they come from? Voices are not imaginary. You really do hear them, but they are created by the mind. So scans have shown that the part of the brain that lights up when you hear voices is the same area that is active when you talk or from words in your mind. So the brain seems to mistake some of your thoughts or inner speech for voices coming from outside. So maybe I'm suffering with this particular thing and I am hearing some voice, but that voice is not coming from outside. Nobody is there, but these are my thoughts, and these thoughts are becoming a voice, and I feel that they are coming from outside, although they are inside speech, my inner speech. Now, do other people hear? If I'm hearing, other people hear these voices. You can also hear voices in a severe depression. If somebody has got a very severe depression, possibilities are that he will hear the voices. They tend to be a simpler, repeating the same negative or critical words or phrase over and over again. You can also hear voices when you are just about to go to sleep, or you can hear voices which don't interfere with your life. They may be pleasant or not very loud or only happen from time to time. These voices do not usually call for any kind of treatment. Other kinds of hallucinations are, you may see that things which are not there. So maybe you just feel that somebody is standing there, or somebody just went near, passed by me. A delusion happens when you believe something and are completely sure of it, while other people think you have misunderstood what is happening. And that is called delusions. It is though you are like you see things in a completely different way from everyone else. You have no doubts, but other people see your belief as a mistaken, unrealistic, or strange. And if you do try to talk about your ideas with someone, your reasons don't make sense to them, or you can't explain uh, that you just know. Now, it's an idea or set of ideas that can't be explained as a part of the culture, background, or religion. Now, how does it start? It may suddenly dawn on you that at last you really understand what is going on. This may follow weeks or months when you have felt that there has been something wrong, but that you couldn't work out what it was. So all these things are like a negative and positive thoughts. Now there are certain facts uh, which I can tell you in very like summary wise facts, that schizophrenia is a mental illness that affects the way you think, feel, and behave. It affects about one in every 100 people. Schizophrenia may develop during early adulthood. There are different types of schizophrenia. There is no one type. And people have positive or negative symptoms. Positive symptoms, I repeat again, when you experience things in addition to reality. For example, you might see or hear things that others do not, or believe things that other people don't. Negative symptoms are called when you lose ability to do something, for example losing motivation to do things or becoming withdrawn. They often last longer than positive symptoms. Professionals aren't sure yet what causes schizophrenia. There are many different causes. The main factors that can contribute towards the development of schizophrenia are believed to be genetics and environment. So these are the two main factors. There are different types of treatment available for this, such as medication and psychological treatments, which are talking therapies. Also, there are certain uh, myths, like suppose if somebody is diagnosed with schizophrenia and they are experiencing some of the following, all these symptoms: hallucinations, delusions, disorganized thinking, lack of motivation, slow movement, their sleep pattern will disturb or change, poor hygiene, changes in body language and emotions, less interest in social activities. They all of a sudden start staying alone, and they will not have any feelings towards their partner as well sometimes. Now, everyone's experience of schizophrenia is different. Not everyone with schizophrenia will experience all these symptoms. Some people have three or four symptoms, out of which I've just told you. Some people might have all of them, some people may have any other. So everybody is different. Now, the Royal College of Psychiatrists, they are saying that 1 in 100 people are affected. And for some people, it is during adulthood and it develops very slowly. The early stage of illness is called a prodromal phase. It's a medical term. So if it's early stage, you are with your GP, then GP will write on his papers the prodromal phase. During this phase, your sleep, emotions, motivations, communications, and ability to think clearly may change. Now, there are certain videos on NHS websites which are really useful. And if you go on onto YouTube channel, then if you type that word, then those videos are coming. They are from Rethink as well, as I'm sure, and NHS. Now, there are certain myths about schizophrenia. For example, people say schizophrenia means someone has a split personality. That is not the case. The mistake may come from the fact that the name schizophrenia comes from two Greek words meaning split and mind. So because of that, it's a Greek like word. So people sometimes mistake that it's a split personality, but that's not the case. Sometimes people, or in media we have seen that if you live with schizophrenia, you can't work. Many people I have seen in my life while working with people with mental health issues, that many people who live with schizophrenia can work either full or part time, especially if their condition is stable and they have right support. Those who live with schizophrenia are often keen to work and play an active role in society. Work can be a key element in recovery. So if suppose you are working with somebody, you have a support group, people are coming there with schizophrenia, then giving them some kind of volunteer work is really useful. Other myths, people who live with schizophrenia are dangerous. Those who live within schizophrenia aren't usually dangerous. People who live with that are far more likely to be harmed by other people than harm others. So, because if somebody is living with this condition in the house, there are chances that other family members may have some kind of like emotional abuse, financial abuse, or they may not understand his condition. So I have seen, and it's on record on very many research, that they are far more likely to be harmed by other people than harm others. Like they will not harm people, but people can harm them. So there is a higher risk of violent behavior from those who live with schizophrenia. But as with people who don't live with schizophrenia, much of the risk is linked to the use of street drugs or alcohol. Now, sometimes people who live with this condition commit violent crimes, and the media often report them in a way which emphasize the person's mental health diagnosis. This can create fear and stigma in the general public. But it should be remembered that violent crimes are also committed by people who don't live with schizophrenia. It is often later found that the person was failed or neglected by the mental health system. And that's why he committed a violent crime. He was involved in violent crime. The crime might have been prevented if the person had received the care and support they needed. Now, what are the symptoms? There are symptoms which I have just explained. So far, any question?
We do have a few questions from Uncle Sheikh Khalid. Would you like to ask it yourself?
Yes.
Oh, you're on mute.
Can you hear me now?
Yeah. Assalamu alaikum.
Walaikum assalam, Dr. Saab. I think actually I wrote it down a few questions. I forgot what it was. It's a very confusing and complicated topic, to be honest with you. It's very in one session.
I do have your questions.
Go on. Can you do it for me, please, Asma? Can you do it for me, please?
I will ask one of the questions now, and then we can ask the rest of them at the end. But one of the questions he asked is, what's the difference in between schizophrenia and psychosis?
Yeah. Right. Okay. The thing is, psychosis is a different illness, and schizophrenia is a different illness. In schizophrenia, sometimes person goes through certain conditions which is called psychosis or psychotic symptoms. But when they treat schizophrenia, so then they always use antipsychotic drugs. They use for antipsychotic drugs for the treatment purpose. And it is like, you see, and when if you somebody is schizophrenia, then it will call, it's one of the several disorders called psychosis. So there are several disorders, and then it's called psychosis.
That is a good example. There is a bit of a difference. And Uncle, is that okay? Did you understand that?
A bit, yeah.
And other question?
So do you have some more? Do you have some more to say, Dr. Shakoor, or are we going on to questions now?
Sorry, what? No, I have a loads. Why? Are we running out of time?
No, that's fine. I'm just thinking if you continue, that's fine, Dr. Shakoor, and we can ask the questions at the end.
Yeah, no, if you have any other question, I can do, and then I can continue as well. There is no problem.
Yeah, I think let's continue because what we will do, we'll stop the recording when the question time comes. So if you want to continue, that would be great.
Okay. What I can do is I can go through certain things which are really important. For example, uh, suppose somebody who is living with the person who has schizophrenia, then what to do? You know what I'm saying?
Of course, yeah, if you can share what one thing that would be important is sometimes people don't ask for help at the right time and it gets really bad. So maybe for some people it would be good to know how how can they offer help
Yeah.
before it gets too late? How can they trust these services? Because there's this distrust on health services and mental health services. How can people trust them?
You see, our first contact point has to be a GP. And when after GP, when that GP will refer to the services. Now, in this country, the services really needs a cultural competence training to understand South Asian people's perspectives of mental health and their needs. In other words, services has to be culturally appropriate, because sometimes health professional, there is a vast difference when it comes to mental health between white British people, European people, and South Asian people. So there are very many things which they need to adopt. And also GP also needs training as well. Even if it is an Asian GP, they need a training around how to understand the perspectives of South Asian peoples and their mental health.
And why is there a difference between the cultures? Because we have
The,
a diverse group of people here. So I just for them to understand as well, because what I
yeah,
want is for people to
okay,
listen and then. So can you
yeah,
explain why it's
yeah,
different for different
yeah,
cultures?
okay. For example, when suppose if a white British person has got worries and lot of tensions, when he is talking to his GP, he usually say, I have got too much on my mind. Asian people don't say that, majority, especially first generation. Asian people relate all emotional or these worries things to heart. So maybe 60 years old lady suffering with minor element of anxiety, tension, worries, talking to the GP through an interpreter, using words like my heart is heavy when you translate. Maybe GP will send her for ECG. She doesn't need ECG. That's the way we describe. We Asian people talk more about somatic symptoms, like a physical symptoms rather than psychological symptoms. So we will talk, I have got some problem with my tummy, something is moving inside, my shoulders are heavy, I can't sleep, my heart is heavy, broken heart. But because we relate all emotions with our heart rather than mind. So also Asian woman, when talking about her symptoms, she might use certain words in her language which translate in English. Insects are crawling in my arms and heads. It's a psychotic symptom, where maybe she is just saying pins and needles. So when we talk about pins and needles in northern Punjab area, people say "Kidiyan chal diyan ne," means insects are crawling. So if interpreter is not well trained in mental health, assessment can go wrong and she could be wrong diagnosed. So there are so many other points. Plus belief in evil eye, ghost, jinn, all these things. So maybe the person is wearing a talisman, which is called taviz, talking to a white counselor. Now, counselor has to understand, she is saying through interpreter, my sister-in-law has done black magic on me. If white counselor will deny, no, nothing, it doesn't happen, she will not go for counseling next time anyway. So counselor needs a proper training that how to build the trust when working with South Asian people. Have I answered your question?
Yes, thank you.
Okay.
Habiba has said something. If you in the chat box, she has said, "I took my brother to the GP first, and then he was." Give me a moment, please. Okay, so she said, "I took my," and I'm sorry that is yeah. So okay, I took my brother to the GP first, and he was referred to a youth mental health clinic. They worked with him for a bit until he reached 25. After that, he never received the proper care or any other form of therapy. They just kept giving him drugs. As long as he was drugged up and not bothering the NHS service, they didn't really care. Even now, it's ridiculously hard to get in touch with his mental health worker. My parents immediately assumed my brother was possessed. But someone else has said a lot of it also has to do with stigmas attached to mental health.
Mm.
And I do want to point out another point here that some people, obviously, there's been a misunderstanding that why is, obviously, this charity helps anyone supporting anyone that's been affected by domestic abuse. So I did explain earlier about how mental health is affected by someone that's been going through domestic abuse, and this is why
Yeah,
this talk is very important. So
of course.
this is why if it's confusing, I'm sorry, but it's anyone that's gone through trauma, domestic abuse, it's a very difficult thing to go through, and people afterwards do suffer with depression, anxiety, complex PTSD, even
Yes.
schizophrenia. They have lots of other problems. This is why we're doing this talk today, just to
Yeah.
make it clear for those that came in late. But
Yeah.
also, Dr. Shakoor, there was a question: what is bipolar disorder?
Yeah. That I'm talking tomorrow.
Yes. Okay. So we will explain that to you tomorrow. That's
Yeah.
another talk. The next one is what are hallucinations and delusional?
When you hear voices, when you see things which are in reality not there.
Okay. So the story that I just told you about the girl who said about her brother and the doctors stopped caring and just giving him medicine after he was 25. What is your thought on that?
But I don't know what he was diagnosed. There are so many mental health conditions. So if I know exactly what was the diagnosis, and then either you can give a sister my
His
number,
the
she can ping me.
diagnosis was schizophrenia.
Right. Okay. So in that case, obviously he will be on some antipsychotic drugs, maybe. And there are again different stages of schizophrenia, and depending on the person, different drugs or medicines GP will prescribe.
But the thing I think that the lady here is trying to say is that, as he was given support, but as soon as he reached 25, that support was no longer there. They didn't want to know. They didn't want to. They don't care. And is that true then? That when a person gets to a certain age,
I
they're not
no,
supported.
no, I don't know about that. I just know that there is two types of services in mental health. One for young people until the certain age, and then after that they count as they moves into adult service. So there are two different services, but I don't know about this after 25 they are not bothered. Is it in Rochdale?
No, it's in a different city.
All right, so I don't know if I know the city, or uh, if you can arrange my meeting with that person with you or somewhere, then I can do some investigation and find out.
Okay, that's something that I will, yeah, afterwards, what I will do is
Yeah,
I will speak
yeah,
to the
no
person
problem.
and
Yeah,
find out how we
anytime.
can help them because they're in a different city.
Yeah,
So the other thing that the person has said is she took her brother to the GP. No, she has said all that already. That's me repeating myself. Another question was, what's abnormal motor behaviors?
abnormal
Motor behavior.
Motor behavior. I don't know. What is this?
The person that asked the question, do you want to?
If you can elaborate a little bit more. Motor behavior, maybe they are talking about a certain kind of brain function, and if a person is not behaving, because when
Yeah,
it comes to
am I unmuted?
no, you are no, I can hear you, Sheikh Saab.
Yeah, Dr. Sahab, actually I was looking at the symptom of the topic we are on about today, and one of them
Yeah,
was the delusion, and the other one was the hallucination. So I just wanted to ask the difference in between two. You just explained it, and
yeah,
again, the third thing was disorganized thinking or speech, and then
yeah,
abnormal motor behavior and
yeah.
negative
Abnormal,
symptoms.
yeah, abnormal motor behavior means that the person's brain is not working in a normal way.
All right, thank you.
I
So
would like you to, Dr. Shakoor, would you explain how someone that's gone through domestic abuse and why it's connected to why it is very important to understand that mental health is, something that does happen to that person that's gone through domestic abuse.
domestic abuse, you mean a person with schizophrenia and living
Yes,
in the family, and how the family members should react, or
that is
kind of,
a question that another person has asked.
yeah.
But I guess what my question is when someone's gone through domestic abuse, why would they suffer schizophrenia?
You see, i- schizophrenia, obviously, if they are suffering with domestic abuse, obviously the it's affecting their brain very badly, their emotions, and then it's not schizophrenia. They can go into any condition. They can go into manic depression. They can go into a severe kind of other health issues. Domestic abuse affect in a very many different way. So if it is affecting the brain, obviously then they will suffer. But people, those who are not subject to the domestic violence, they can also have a schizophrenia, and it's a genetics as well.
That's brilliant to know. We have a question here. What coping strategies do you suggest for someone that is living with schizophrenia?
Yeah. Okay. Suppose if somebody is living with the person who has got schizophrenia, then the person, first thing the person needs is to contact soul sisters, means educate yourself, educating ourselves first, that what exactly my partner or my family member is going through, what is his illness, what are the causes, symptoms, what things are. So education means awareness. So if I don't know anything about myself, what schizophrenia is, how I can live with the person? So first I have to know. So educate yourself. Second thing, listen. So listening is very important. If person with schizophrenia is talking to you, then you listen and use empathy, not arguments. If person is saying, for example, I live with a person, suppose, who has got schizophrenia, and uh, she says, my wife, for example, and it is not, I don't have any problem in talking about that my wife had schizophrenia. She was the patient of, and I lived 14 years. So no empathy, no argument. So if she says, uh, I can hear the voices, somebody saying that I have to do this. I don't want to, but I have to. Now I will not say there is nobody here. I can't hear. No voices are coming. Not that. What I will say, I know these voices are making you really very uncomfortable. I am really concerned about this, that you are hearing these voices. That is the proper way. No argument. Now, don't take it personally. I never took anything personally, even though I was attacked by a knife on one occasion in front of my two very young children. There I'm talking about 25 years ago. I didn't still took it personally because I know the person is not well. Mental health is a really very, very severe thing, and we have to understand. So, but at the same time, take care of yourself. So then obviously contacting, and you won't believe me, Asma, when police came and they found out that she had a knife and attacked and everything, they asked me to leave the house for a couple of hours until the things are cooled down. And 2 days later, a letter came on my doorstep for my wife saying, "We have heard that you were subject to the domestic violence. So if we can help you in any way." And I went to that agency who sent this letter. I said, "I was the subject, and you are sending the letter to her. What kind of communication you have with police department?" So, things are really dodgy. Maybe things have changed now. So taking care of yourself means you have to make sure that you are safe. Now, you have to maintain your social network. Even though I was going through that, but I never missed my social contacts, talking to people, full-time job, going into poetry events, organizing musical events, doing a radio show every weekend in Asian Sound Radio or Crescent Radio. I did all these things. So you have to maintain your social network,
Okay.
you have to encourage your loved one to keep up with, and you have to encourage, if your wife, husband, brother, sister, to keep up with the medication and recovery plan. So encouraging in a very diplomatic way, with supportive way. Also, you have to take action if you think you or your loved one are in danger. Then you take action, which I did in my case. So whichever the situation, you need you should have all these numbers and contacts where to go. 25 years ago, things were very different. Not very many things available. Now everything is available. There was no soul sister at that time. Otherwise, I would have gone to them.
Thank you for that explanation. It's really nice to hear your own experience as well. And I think this is a good example of what you said to someone who was on the other side. And that's really important as well, is that if you are living with someone else in the house that is going through schizophrenia. The other question was, how would you talk? So the person that has a psychotic break, how do you talk them down? How do you calm them down? So when the other person is having a psychotic break, how do you calm them down?
I think the best thing was that I have to keep quiet and very, very calm, and like uh, try, if it's not really dangerous, doesn't have any kind of instrument in his hands or anything, then I will just move that place for a while, because these people, they need space as well, and their own time as well they need. If it's really, really dangerous, then I have to call the services.
So sometimes either you can call the services, but not everyone has those services numbers to hand. So you can call the police as well, can't you?
Yeah, of course you will, and then police will take it from there.
And you can call the ambulance service as well, emergency services.
Emergency,
Um,
if there is a life threatening.
and I know that there is this thing about how do we trust these professionals, but sometimes there is no other way. You do have to trust them. And actually, you just have to make sure you have an advocate and you talk to these professionals um,
you you
openly.
you
Either
you,
take a
you can
family.
trust. I have been working with professionals almost 35 years. You can trust them. They do not do anything deliberately wrong. It's just most of the time they are not aware of it. our culture, our needs, they are not aware of it. And sometimes they have, in inverted commas, they have a fear of discrimination, which can affect their job as well. So they are sometimes scared of doing or saying something.
I
It's
understand
just,
that, but
yeah,
Dr. Shakoor, not every doctor is like you, and in every profession, there's always a few that don't follow the rules, and and that's why people lose trust.
yeah,
Like
I
even
know,
the
I
police
understand.
system, there's lots of things in the news, so people do
Yeah,
lose that trust. Obviously, we're not saying everyone in every profession is a bad person and you can't trust them, but there is a
yeah.
reason why. So, but it's really good to know there's a doctor like you and that you're on this talk doing this. The other question is, how do you get help for someone who's in denial? So there are people who have schizophrenia, right? But they deny that, they don't accept it. How do you support that person? How do you get help for them?
You cannot get any help or support from outside as long as person is in denial. And then nothing, because in this country, if person doesn't want to take any medicine or cure, then you can't force that person. As long as that person is not dangerous for himself, herself, or you, for you, then ideally you can't do much. It's just you can try hard to convince that person in different ways that go for treatment or kind of thing. My wife was in denial as well. In fact, my in-laws were saying she's possessed by ghost and black magic. Can you imagine that? So, and they are all from British born. They were not from Pakistan. So it was really, it took me long time to convince. And when I spoke to her GP said, if she is not coming for any medicine, how can I do? I can't do anything. And then I just, what did I do? I did something which made her to go to the GP. Yes, she was suffering with some kind of flu and asthma and something. And then I said, look, this is affecting, and it's a flu, it's a virus, children will affect. So we have to go and see the doctor. And I spoke to the doctor. I said, look, I am coming. Now it's your job to do at least something. And then he asked certain questions and things. And then she said, I can't sleep properly and all this. So then he said, oh, well, I'm giving you some medication. And that's how a little bit start. So that was my strategy. I don't know that works for everybody or not, but this is what I did. And that I'm talking about almost 23 years
And
ago.
I'll tell you, Dr. Shakoor, that things haven't changed that much since 23 years, I will tell you that. There is someone here
Oh,
that's saying, so the lady that said about her brother, he was in denial as well. And she convinced him to go to the GP. But she went with him because he was too scared to go. My own brother has schizophrenia. He was 14 years old in high school, doing very well. He was doing really well in the studies. He was number one in academically, sport-wise, and suddenly, something changed in him. And the teacher got in touch with my father, and we had to get him help. So he's always had it since he was 14 years old, and he had a relapse when he was 30 years old, and he's been in hospital the last 4 years. And my mum still believes that he's possibly possessed, he needs some help like that. Whereas my dad, who's come from Bangladesh, he actually accepts that we do need to get help from the doctors and he needs to take medication. So you know what, things haven't changed that much since when in your time, Dr. Shakoor. it's
all
still
right.
it's still this like stigma. But my brother was in denial as well. Even now, he doesn't accept that he has schizophrenia. He doesn't want to hear that word. So you have to treat
Right.
these patients. They are patients. You have to treat them like a baby, really. You have to really look after them and be nice and caring with them, and just make sure that you don't, um, yeah, you don't stress them out, because stress makes them even worse.
Yes. And sometimes people, those who are on medication, the side effects are really dangerous sometimes. One of the antipsychotic, this drug is called clozapine. So So it's got very many side effects.
Yeah, because my brother was on quite a few different medication, and the doctors, after so many years, they changed it just like that. They said, oh, he's gonna have a heart attack, and he's gonna,
Yeah,
and they just changed it, but that affected him even more, because he was doing really
yeah,
well on those medication, but it is kind of scary, isn't it?
yeah. CBT is really useful in schizophrenia. CBT really works, cognitive behavior therapy.
Thinking ahead.
Sorry?
Sorry, the organization called Thinking Ahead also. I'm having treatment with them through the CBT and for the
Yeah.
PTSD. So every
Oh,
week
yeah.
they do about an hour and a half video call. I'm
All
getting
right.
the
Okay. Yeah,
EMDR
this,
treatment. EMDR
yeah,
treatment.
it's
Yeah.
good.
EMDR, yeah, that's an eye movement, some sort of therapy, and
Eye movement.
basically, yeah. So we've got a comment here saying, I do think in South Asian culture and many others, too much expectations, and we think being perfect is normal. I have known people to hide issues about schizophrenia rather than confront it. We need to be braver.
Yeah, of course. Sometimes people have difficult childhood, and that also causes uh, kind of mental disorders. So there are so many things, family problems, stress, drugs, non-medicinal drugs like cannabis, amphetamines. So
That's brilliant. Thank you. I think we're coming to an end of the session.
yeah,
Yeah,
and we are meeting tomorrow again.
we are. So,
Okay.
yeah. So I think one of the good suggestions was that at the end of the session to mention within the Rochdale Borough, there are charities that do support with
Yeah,
mental health, and there's some that obviously the main one is Mind. That's the big one, and then you've got Living Well, Thinking Ahead,
yeah,
and then after really is go to your GP first, I would say,
yeah,
and then from there they usually will tell you to self-refer yourself, and if you don't think you can self-refer yourself because you're not well, you can actually ask the GP to do that for you. At Soul
yeah,
Sisters, we do advocate, so we will support you in doing that self-referral. You could be waiting a few months before you get any support. That's the other thing as well, the waiting list is quite long. um,
yeah,
if you're not in the Rochdale Borough, then Mind is the big one to go to. But the first one I would say is speak to your GPs because they'll know what services are available in your local area. And sometimes you might not need medication. It might be that you need other therapy, you know. But yeah, the best thing to do is if you don't trust your GPs, like Dr. Shakoor was saying, and other people have mentioned on here, is that they went with their family member, is to maybe ask a family member to go with you. So you have that person that's your witness or a friend to go with you. And if you're the person that is on the other side and you know someone that's suffering, then try to let them know all the options, give them a few days, let them know again. Just let them know, and eventually they will hopefully go with you and get that support.
yeah.
Um, so
Yeah,
our
is a G. Yeah,
yeah, go on,
G.
Dr.
Yeah,
Shakur.
GP should be the first contact because after certain tests he can diagnose because there are different types of schizophrenia. One is schizophrenia with paranoia. One is called hebephrenic schizophrenia. Then catatonic schizophrenia. So there are different types, and GP should is the first contact. There is one is called simple schizophrenia, like negative symptoms are prominent early and get worse quickly, and positive symptoms are very rare. So it's called simple schizophrenia. Residual schizophrenia. Then there are so many different types.
That's brilliant. I'm going to stop the recording here, Dr. Shakur, and then if anyone wants to ask questions after we stop recording, they can do. But I
Okay.
really want to thank you for coming on
Yeah.
and sharing and answering questions and listening. And thank you to everyone as well to get involved and share your
Yeah.
experiences. I really
Yeah.
appreciate that.
Yeah. I think people sometimes really want to know that what are the causes of schizophrenia. So there are what they found the 5 main causes. stress, genetics, brain damage, drugs and alcohol, a difficult childhood. These are the 5 categories we have to remember. And that's all. I'm not talking anymore.
Okay, I'm going to stop the recording. Thank you very much, Dr. Shakoor.